You wouldn't buy a car without a seatbelt, a laptop without Wi-Fi, or go a day without your cell phone. Could a business survive without the internet? Then why are many healthcare providers and provider organizations still not connected and enabled to share critical clinical information digitally in the care of your friends and family? Welcome to Kno2fy, a podcast from Kno2. Join host Dr. Peter Schock, Chief Health Officer, and Teresa Bell, Founder, President, and CTO, as they bring the profound impact of healthcare communication to life through frank conversation in understandable language and through real-world context. They'll demystify interoperability, helping you unlock the potential of healthcare communication at scale. You'll also learn the transformative impact of being Kno2 connected. Connect, listen, transform.
Welcome back, everybody, to another episode of Kno2fy. So happy to be with you all today. And we have a special guest today that I want to introduce here in just a second. But first, a note, Teresa is not with me today. She is, my normal co-host is out and unavailable today, but she will be back with us on the next episode. But I'm so pleased today that I'm not really alone, even though Teresa's not here. I've got Adam, and Adam, I'm going to butcher your last name, Baliatico. Is that correct? Did I say that correctly?
Actually, that is better than most people do. Baliatico.
Better than most, but still not right is what I took away from that. So, Adam, without further ado, I'm going to introduce you and have you introduce yourself. Tell the audience who you are, why you're here today, and a little bit about yourself.
Yep. So I'm Adam Baliatico. Thanks for the intro, Peter. I'm excited to be here. I am one of the co-founders of Prompt. We started back in 2017. I primarily oversee our product development, our product roadmap, making sure we're continuing to innovate and deliver a lot of value for our clients and for the PT industry.
What did you do before you founded Prompt? What did you do before that? What is your background and how did you get into doing this in the first place?
Yeah, so I went to Boston College. Mike and I actually started Prompt while we were in college as seniors. He was a patient of physical therapy. I was a patient of physical therapy pretty frequently as well. And Mike was in PT for a torn labrum. He had been getting PT for about 6 months, and he just wasn't really happy with the technology that he had available to him as a patient. So actually, the original concept of Prompt was going to be a patient recovery tracking application that allowed patients to basically see their range of motion, their progress to their goals in a very easy to understand way. We actually built that in college. We partnered with a college development agency, and it ultimately ended up not being the product we went to. I was a finance major by background. I had been working in investment banking for a few years and just ultimately didn't really want to go down that path. So we ended up sitting in physical therapy clinics a lot trying to sell this HEP app. And everything we kept hearing was, that's a great idea, but we're not going to add more software to our practice. We have 4, maybe 6 or 8 or 10 pieces of software that don't talk to each other. They don't work well together. We can't ask our therapist to basically document twice. That just wasn't going to be an option, and they would have had to document twice for this app to have value. So we had kind of 2 options: either integrate with the existing EMRs and have our application kind of service this small portion, or what we realized in sitting in all those PT clinics was we could just build an EMR, practice management, patient engagement platform. And by building it as an all-in-one solution, we could really help revolutionize the PT practice and take it to the next level. So then actually that brought us to like late 2017, and we spent about 2 years building the initial product that we launched in late 2019.
Man, that is amazing. I can't tell you how impressed I am with that. And I think it's funny because I hear many times in entrepreneurialism that there is a personal experience that creates a commitment to which skill sets are applied that leads to a product to market or a service to market that wasn't here before there. I look forward to digging into that. We're going to take a quick break, Adam, after the introduction here, and we'll come right back and we'll start digging into Prompt, its history, what it's doing, etc.
Awesome.
Uncover the narratives that fuel Kno2's success on the Employee Spotlight segment of the Kno2fy podcast, where we delve into the unique stories and passions propelling our team forward.
Can I have you state your name, your title, and what you do here at Kno2?
Yeah, so my name is Lisa Moore. I'm the VP of Healthcare Network Services. And what do I do here? I don't know. I kind of do a little bit of everything. But at this point in my tenure here at Kno2, I really am overseeing our support team and implementation and onboarding team and helping to make sure things are running smoothly for our customers.
Perfect. What would you say your why is for working at Kno2 or in healthcare technology in general?
So it's kind of a long answer, I think, for me. Initially, my why was because I'd worked with Teresa and Dane at a previous company. And so when they left and started what is now Kno2, I ended up following them. But I think over the years, I was the very first employee of Kno2. And over the years, seeing what it's become, I have a lot of passion for what we do and just being able to help the healthcare industry and hopefully therefore patients and the care that they receive is something I really feel good about coming to work every day.
Absolutely, making a difference. I feel like a lot of people say very similar things. This is a company that you absolutely can make a difference in. Okay, moving into the fun questions. If you could be a superhero, what would be your ideal superpower?
So I think my ideal superpower would be being able to teleport. I would love to just instantly be somewhere else and then back and moving around wherever. I think that'd be awesome.
Absolutely. You know how much that would save in travel costs?
Please.
Okay, what is the first thing that comes to your mind when I say think of a happy memory?
I think what pops in my head is anything with my family that's outdoors, like camping. We have fun camping trips with friends, or recently got to go to the beach. Anything outdoors, hiking, skiing, love.
What's the most unique or unusual job you've ever had before joining Kno2, and how did it shape your perspective on work, life, any of it?
I don't know if it was very shaping of perspective, but I think most unique jobs would be my very first job was detasseling corn because I grew up in Iowa. And so getting up at 4 a.m. and riding a bus out to the middle of a cornfield, that was something. And then my first job, like actual job after that, was Krispy Kreme donuts of all places. And it was right when it first opened in Des Moines and the lines were around the block. So
nice.
random.
And imagine how much it shaped like your work ethic. Sitting out there at 4 a.m. growing up, I could not get a single kid I know to get up at 4 a.m. and go to work before they go to school. Not one.
I thought that seemed like a good idea at the time, but it was fun.
That's awesome. Okay, well, thank you so much for spending this time talking to me. I hope you have a wonderful day, and I will talk to you later.
Thanks.
Stay connected for more captivating insights into the exceptional individuals driving innovation at Kno2. Connect, listen, transform. This is Kno2fy with your hosts, Dr. Peter Schuck and Teresa Bell.
Welcome back, everybody. We've had a wonderful introduction and understand the why Prompt was founded, Adam, and I really appreciate that and can really identify with that. I'd love now, if you don't mind, getting into a little bit more about Prompt itself, a little bit about what it does, what it's solving in physical therapy, those kinds of things. That would be fantastic.
Awesome. Yeah, happy to do that. So we are a full service EMR, practice management, patient engagement, reporting, RCM. We kind of do everything for the PT practice as a software solution. Cloud-based and all-in-one platform. Super modern tech. We're always innovating and trying to update our platform constantly. And I would say at a high level, the way we approach the product and the company as a whole is, everything starts with the customer, with the PT clinic. We have to deliver value for PT clinics and help them grow their business, run more efficiently, make the job of their therapist easier. And we think about it really from a macro lens. There's 5 users of our software. There's the patient, which is often a forgotten user of kind of enterprise software.
Love that. Yeah, love that perspective.
Yeah, that's kind of, I think, Mike and I's unique perspective of, we got into this as patients, so we wanted to deliver really awesome, modern tools for the patient. And then there's the clinician. Everyone that builds software in this space builds for the clinician, so that's not unique. But then there's the biller, the admin, and then kind of like the owner manager level. So we think about those 5 user groups, and there's really 4 things we're trying to do with our product and with our success team as well. And I'll get more into this later, but increase the efficiency of every user. So to us, if you're not building a product that solves for all 5 of those user groups, you can't increase the efficiency really of any of them, because the physical therapy practice is really this circle of collaboration between all 5 of those people. So increase the efficiency of all 5 of those people or types of people. The second is wow your patients. As a physical therapy clinic, there's over 30,000 of them in the United States. There's tons of other things that are competing for a patient's time. You have to deliver an experience, both from a human side, but also from a technology side, that really wows your patients, makes them want to come back to physical therapy. I think Mike always says, like, going to PT as a patient is sometimes painful. Like, you're there because you're hurt. You don't want to be in PT, but to the extent we can make technology help you want to go there or make your experience going there easier, we want to do that as much as we can. The third, as finance background, Mike and I both, like, it's purpose built to impact your P&L and help you make higher revenue, decrease your costs, ultimately make more money. And we think all of those things lead to the fourth, which is a happier staff, especially on the clinical side. Like, burnout is a huge problem in the space. PTs are leaving the industry faster than ever, even though there's a huge demand for physical therapy. So to the extent that we can make you more efficient, make your patient experience better, and make more money, which ultimately makes its way down to the staff, we can have a happier staff. And so that's really our mission as a company. And our CS team, our customer success team, is empowered to do all of that as well.
Man, I cannot tell you how much what you just said aligns with how we view interoperability at Kno2. When I think about healthcare's biggest problems, and interoperability being a solution to healthcare's biggest problems, that's a big statement. Nobody understands what that means. But when you break it down into 4 personas, which remind me of the 4 places you're trying to impact with Prompt EHR, and that is the P&L of a business, right, of a healthcare business. How can we make workflows more efficient? How can we actually make workflows that become have less friction so that we can optimize revenue streams, et cetera? How do we make the provider experience better so that we're addressing provider and staff burnout? And when I say provider, I don't mean just doctor or therapist, but everybody involved in the frontline care delivery. The patient, how do we make their care environment safer? How do we coordinate their care better across a fragmented continuum? And then there is a responsibility for us on the bigger healthcare ecosystem. How do we actually reduce cost in the healthcare ecosystem? Well, you can do that pretty simply by making a CT scan available to a provider that was done at an urgent care 3 days before, so that he or she doesn't have to repeat the test. So, but it's interesting. Your personas of impact for Prompt, I think, is very much aligned with how we're thinking about interoperability and discussing interoperability. But I have to be honest, you're the first EHR company that I've heard talk about those 4 dimensions, to be honest with you. And as a provider, having had EHRs outside the physical therapy space, they weren't built for me, and they weren't built for my patient. I mean, we slapped a patient portal on them, but they weren't built for me, and they weren't built for my patient. So it is really, to me, and I use this term not lightly, revolutionary to hear you guys talk about the impact across those 4 areas. Really impressive. Really impressive.
Yeah, I mean, it's definitely, we got into this, and a lot of the softwares, or the way they get marketed, it didn't encompass the whole picture of what a PT practice is. It's so much more than just the clinician and you have to deliver that care that, like, most clinicians get into PT because they want to help people get better. You need your technology to be solving and checking a lot of boxes so that your job can be focused on helping that patient get better. But if they're not coming in for the right number of visits, if they drop out of care because they're frustrated with the scheduling workflow or the bill pay workflow, like, they're not going to get better. They're not going to reach their goals. And ultimately that it drives up the cost of healthcare. It makes the experience for the providers more frustrating. It decreases the profit margin of the PT practice. It just creates this negative spiral that if you don't solve for really that patient experience, you're leaving so much on the table.
Yeah, and I love when you say we talk about patient experience a lot, and I love how you drew that line. You've got to address the provider experience in order to deliver an optimal patient experience. So you can have a ton of great things for patients, but if the provider experience and the way they deliver care and the tools they use to deliver the care aren't what they need to be, you'll never get the optimal patient experience. So I really love how you made that connection there. What do you think is I would imagine that model would be pretty well received in the PT space. You guys must be growing like weed.
Yeah, the growth has been awesome to see. Luckily, our customers are our strongest advocates. About, like, actually 40 or 50% of our new business comes from customer referrals, and we don't pay for referrals or anything like that. They just refer us to their friends because they had a great experience with us, and they want more people to have a great experience with us. And our customer success team is so pivotal to that. It's the majority of our company is customer success, which is unusual for a software business. Most of the time, they're overstaffed in sales and marketing and R&D. Customer success is everything to us. We want all of our customers to love using Prompt, and it's more than just teach them how to use Prompt. Our CS team is an extension of their business, and they learn their business really well, and they can provide tips and tricks on how to run a better business or how to solve this problem they're having. So the growth has been awesome to see, and it just allows us, the more we grow, the faster we can actually develop the product and iterate and keep delivering more value to the clients.
You guys must have done a fair amount of probably informal, but also some formal empathy sessions to really understand what a PT provider, what a PT practice needs in order to meet at least three of those dimensions. And it sounds like you also drew from your own personal experience on the fourth in terms of what the patient wants. Did you guys do that? I mean, it's unusual. I have to be honest with you. It's unusual to hear that as a provider thinking about an EHR. Actually listening to the problems that a provider and a provider practice has and trying to design something from the ground up that begins to solve those problems.
Yeah, it's actually a funny story. Mike was in a Barnes and Noble buying books, and he bumped into our first partner who owned 3 PT clinics at the time, and he was super frustrated. They just got talking in the Barnes and Noble, and he became our test case, and we picked his brain for a ton of stuff and used that to build the first version of the product. There was a lot we didn't know yet, obviously, so it was just continuing to listen to the customer. I think it's actually a strength of ours that our founding team was not physical therapists, because you're forced to listen to the customer tell you what they need or what they want or what pain points they have, versus I think if you're starting a technology company where you're a quote unquote expert in the space you're starting it, you may be more closed off and closed minded to listening to that feedback.
Yeah, it's interesting because I think I've seen it on both sides. I think I've seen sometimes where technology solves a problem thinking they have the knowledge to do so, and then the solution doesn't resonate and actually doesn't do what they think it does. And then I've heard the other side where providers have a myth of competency where we think sometimes because we know healthcare, we know all the other things that need to happen as well. And one of the things I'm remind our team of a lot is that if you have a PT experience, if you have one provider tell you their experience, that's one provider experience. And yes, over time, you can begin to see patterns in how they're looking at things. And there might be options to common problems that they solve commonly. But there's a lot of variation out there in terms of what people need and what people want, by and large. Do you guys have a lot of ability to customize your program within an installation?
Yeah, so it's interesting. Our software is a single platform. We don't support like different versions of the platform. We've built a lot of configurations versus customizations. Like, the platform looks and feels and functions the same for every single team, from our one provider startup who opened their practice last week to our largest clients who have hundreds of clinics across multiple states and doing millions of visits a year. They're using the exact same piece of software. They configure it different. They turn different things on, different things off, but it's all one platform. And one of the other things is when we're doing our customer research, we try and get the people we're doing the research from not to tell us what you think the solution should be, but focus on what are the problems, what are the business things you're trying to accomplish through software that you're not currently capable of solving. And then our UX team, we have a whole team dedicated to just user experience design, and they're experts in how to solve problems in the best way. And so when we can get providers and administrators and billers talking just about what is the problem you're having that you need a solution for, our team can take it internally and come up with, innovative, creative, world-class solutions. That is that really happy marriage between leveraging the provider's expertise, but we have user experience design experts who are some of the best in the world, and leveraging their expertise as well.
Man, that's fabulous. What are some of the areas that you see as kind of hot topics, or you're getting a lot of requests from physical therapists, or interest in from practices around, hey, we need something that solves differently for this? Because I would imagine you're constantly iterating as the challenges in healthcare never stop. There are always new challenges, better ways to do things. I used to say that the two things that drive innovation in healthcare generally are reimbursement models and regulatory controls. They're the same things that tend to thwart innovation as well, but they tend to drive innovation. So what are you seeing on the horizon of what you're being asked for? What are common problems that people are having now that you guys are trying to solve for?
Yeah, it's a good question. We do over 15 major releases a year. We release over 1,500 customer feature requests a year. I would say about 2 years ago, the biggest thing we were hearing was around it started with everyone saying they need more patient volume. And then when we would interview owners and managers, they thought they needed more new patients. We actually ran a study of all of our customers. How many patients do they have? What is their prescribed plan of care? So what is like the maximum number of visits they could do if they were booking patients properly? And what that showed was actually 90% of our practices had enough existing active patients that if they were booking fully according to their plan of care, they'd be fully booked. So while a lot of companies in the space were focusing on marketing tools to get more new patients, we actually pivoted and built a kind of a revolutionary set of products around you actually have enough patients in your clinic to be more than fully booked. Let's build tools to keep those patients in for the plan of care. We call one of them plan of care compliance automation. One of those is an automated wait list. So every time a visit cancels, an invite goes out to fill that slot to someone who wants to come in that's underscheduled. And we've created some pretty groundbreaking results with that product. So the average increased revenue per therapist per year in 23 from the people using that product was $32,000 per provider per year in revenue. And it's not just revenue. Those patients are getting better outcomes because they're coming. If the therapist says you need to be there 3 times a week and you go once, I know this all too well. I had a 1.5 year recovery from my ankle because I refused to go to PT for the right amount of visits. Like I wasn't getting better. So it hits home for me really well. And so that was what we built 2022, 2023. And this year, a lot of it is obviously around interoperability and, hence the partnership with Kno2fy. Trying to streamline the administrative burden around plan of cares, incoming referrals, managing those things, letting the doctor understand how the patient's doing in PT, and conversely letting the PT understand what's going on at the doctor's office. So that's one big area of focus. And then more and more just combating that margin compression, right? PT reimbursement goes down every year. The cost of providing PT is going up every year. So wherever we can build tools to kind of supplement that and either decrease the administrative costs or increase the revenue opportunities. Those are really always our big focuses.
So Adam, you mentioned this and brought up the scheduling thing is really cool to me, and it makes you realize that they weren't maximizing all the work that they had already invested to get patients through referrals, reputation, everything else, and that relatively low-hanging fruit, but needed the technology to do it. I really love that. What about when you talk about interoperability, since you brought that up, what are the workflows in PT that you see as a system of record that you guys can impact and that can be impacted by being connected to the healthcare ecosystem in a different way through interoperability?
Yeah, the one I'm most excited, and I mean, it's crazy how many faxes a physical therapy clinic is still sending on a day-to-day basis, but the plan of care workflows and, obviously the requirement that you get a signed plan of care is up for debate whether that's valuable or not, but it is required right now. So being able to connect with someone like Kno2, where that whole workflow can become pretty automated and actually the ingestion back into Prompt once we get that signature and being able to just say, we know this plan of care is for this patient. We don't need an administrator to go associate that file with the right chart or things like that. So the
Yep.
plan of care is one. It's, a lot of like larger companies, if you're 10 plus clinics, you probably have a full-time employee who's just sending and uploading plans of care. There's a lot better things for that employee to be doing that create more
Yeah, and there's a
value
dependency
than
on a
that.
signed plan of care for revenue. So
Yeah.
it is not only an efficiency thing from an expense perspective, but a revenue preservation or revenue optimization
Yep.
workflow as well. Yeah.
Yep.
Yeah.
And then
And keep going, man. Sorry. Yep.
Yeah, no worries. The other main area is the incoming referral. Obviously, our study shows you have enough patients, but that doesn't mean you want to waste a referral. And you don't want to deliver, even though they're not technically a patient of yours yet, you don't want to deliver a bad experience to that potential patient. You want to deliver a world-class experience. So by leveraging, an integration and a partnership with Kno2, our system can identify that incoming referral immediately and kick off all the new referral workflows. And part of our system, obviously, we have we built a new patient scheduling platform, so we can send the text, send the email to that referral before even a human looks at the referral, and have them into our booking workflows and the call automation and text and email automation. So being able to recognize that inbound referral, but then also communicate back to the doctor on the back end that says, hey, we converted this referral. Thank you for that referral. Or
Yep.
we were never able to get in touch with this referral. Are you able to help us out? So closing that loop where it doesn't have to be like a monthly phone call with the referral source, or in most cases they just never happen. The loop never gets closed. The doctor sends out a referral, and unless they're coming back for a follow-up in the doctor's office, they might not even know where they went to PT.
Yeah, it used to be that the last thing I really knew until the patient came back to see me, which was long after their course of physical therapy, especially if it was successful, was the plan of care that I signed, right? And that was kind of the closed loop, if you will, at the time. Speaking about referrals just for a second, I think it's interesting because I think not only does it optimize the efficiency, but I have heard and experienced in prior settings that if referrals aren't handled in a timely fashion, which includes the intake process of getting the information, recognizing referral, and then to your point about scheduling them, finding a place for them, there's a drop-off rate pretty quickly after about 48 hours and certainly after a week if the referral hasn't been ingested and responded to appropriately with an appointment. So there's another potential revenue optimization component to that workflow that you're talking about in that regard.
Absolutely. Yeah. I mean, the immediacy of the follow-up is pretty pivotal. You have to be in touch with that patient within a couple of hours, or your chances of converting them into a patient are pretty low. And for a lot of teams that spend a lot of money, time, effort getting these referrals, when they see the data on, we're losing 40% of them or 50% of them, or we're never even getting in touch with 10% of them, like that
Yep.
is an expensive loss, because that, if you convert that patient, especially with our scheduling optimization, where they're actually going to show up for their plan of care, like that's a super valuable referral, even more so than the typical practice not using Prompt, where you might only get 6 or 7 visits per referral. Our clients are getting 12, 13, 14. So there's that kind of double effect of losing a referral. So you've got to be sharp, quick, and have really good workflow and process on top of converting those referrals. And it all starts with, your system being able to recognize that is a referral, which is part of that interoperability workflow.
Yep. It's interesting too. A lot of my background is in population health and leading population health, and we always talk about covered lives and the value of a covered life over time, whether that's a year in a contracted period of time, or you can get on into the value of a diagnosis and the spend that's usually associated with a diagnosis when it's well managed. In the PT space, the value of a diagnosis is not just a visit. It's no longer thinking the value of a visit, which is actually an inefficient way to look at it. It's the value of the captured referral for the duration of their care plan, as you're describing, and you guys have set up tools to do that, which is really, really cool. The care plan thing is another big one. I mean, when I think about the costs in a care plan process now, and you mentioned fax, Fax is still about 70% of healthcare communication. And part of the reason it is because people don't understand that interoperability is not a technical phenomenon. It's actually the impact of sharing information digitally and more seamlessly. And so clinicians like myself don't really understand interoperability. We don't think we need it. And we don't understand its impact in that regard. I think that's an educational thing and a conversation shift that we need to have around the interoperability piece. But the point about fax is there's a cost per page to send a fax, a cost per page to receive a fax. And when you think about a care plan that might be 2 or 3 pages long, 5 cents a page, costs 15 cents to the person who sends it, 15% to the person who, 15 cents to who receives it, 15 cents for them to send it back once it's signed, and then 15 cents to receive the signed fax. Doesn't sound like a lot, but when you're doing that thousands of times in a month in a large PT practice, or thousands of times in a year, tens of thousands of times in a year, it really, really adds up. Not to mention the personnel that has to go pull it off a fax, collate it, even if it's digital or e-fax, et cetera. So lots of opportunity for efficiency in the care plan pieces, as you mentioned. What else is big on your radar? What other challenges do you guys see either forthcoming? We talked about the MIPS a little bit. The MIPS to me is an interesting thing because as you and I have talked about before, but we've talked about with others as well, is there's this gate about being a certified EHR. And if you don't meet the gate of being certified, then that 25% of promoting interoperability category gets spread across quality and practice improvement activities, which may or may not be advantageous in that regard. And then promoting interoperability, if you are certified, has those 5 objectives with a number of different measures that then being connected and being able to query is one of those measures in that process. But are you getting a lot of people asking about MIPS from a promoting interoperability perspective, or are there other reasons they're asking about it?
Yeah, I think I'll go back to actually your original point there about interoperability and how providers might have this view of it that it's not valuable. And I think, unfortunately, that was started a lot by some of the companies in not just the PT software space, but the general healthcare software space, marketing that they're interoperable, but really all they did was build a lot of one-directional integrations, and those actually take away value from the provider. So one of the things we've always done, we don't have a one-directional integration. There's no such thing as one-directional integrations with Prompt. We work with lots of awesome partners and technology companies, but every integration we build is a bi-directional integration where people can still use Prompt as their system of record. They can do all their work and workflows from Prompt, but we're leveraging technology that's communicating seamlessly. So I think, unfortunately, a lot of that interoperability kind of negative view was done by some of these software companies that wanted to market interoperability when really it was the opposite. A one-directional integration is the opposite of interoperability. So I think the more people can combat that and try and build truly bi-directional integrations, in the modern software world, integrations are pretty easy to do. So if you modernize your platform and build those bi-directional integrations, we can shift that mindset of the healthcare provider and show them all of our integrations our providers love because they get this awesome experience. It creates value for them.
It sounds also like I agree with you, and I think point-to-point connections, whether in the past, don't scale either. They're costly, They don't scale, and yes, you can get some discrete information and so forth, but there are much broader, better mechanisms of exchange now that aren't as costly and allow that bidirectional communication. The other thing, though, I want to emphasize this because I hear this. You haven't expressly said it, but I hear this in the conversation we're having. One of the other things to me, if I look at interoperability, and I'll stop using that word, but if I look at that and define it as intelligent connectivity, which is the bidirectional connectivity you're talking about or integration you're talking about, and then meaningful communication, which means what happens to that data when it's received and how it's put into a workflow. So I had this thing as a provider. People would always tell me, hey, we can get you more data. And I'd say, I don't want more data. More data just increases my intellectual anxiety about my risk. I can't process it all. I can't sift through the noise fast enough, et cetera. What I need is information, which is data with context, put into my workflow in a timely manner so that I can make better clinical decisions, because then that data actually becomes knowledge to me. and makes me able to improve my workflows, improve my clinical decision making, those kinds of things. And I think that's one of the, I don't hear you expressly say that, but it seems implied from the conversations we've been having, that it's not just important that you're connected and have information. It's how you tailor the workflow related to that information to drive the provider and patient experience. Is that a fair statement, Adam? Or
Absolutely. Our dashboards and our tools and our reports, like everything is built around giving you the data you need in the places you need it. And like you said, I don't just need a report of all this stuff. Like, what is the action that report is supposed to drive?
Yeah.
And how can Prompt build a tool to help me do that efficiently? Or in some cases, to just do it for me with the technology. So yeah, it's not just, there's almost sometimes too much data and you need to whittle it down to more actionable data. And like we have a whole dashboard where your goal every day is to get your tools down to 0 at the end of the day. That means you got all your work done. Like that type of data drives efficiency and revenue, whereas like just a report or a bunch of data streaming in somewhere, it can actually make your business less efficient.
Yeah. Yep. Totally agree. Totally agree. Man, this is a very excellent conversation for me. I got so many questions that I want to ask you. We talked a little bit about the importance of interoperability and therefore kind of the partnership with Kno2. What workflows are you particularly looking at Kno2 to help you integrate or improve in your product for your clients that you serve?
Yes, I think we've touched on them a little bit, but the inbound, receiving that referral, and instead of like a human having to flag that thing as it's a referral, like we can recognize it through our integration that, this is a referral. So we need to immediately kick off that referral management workflow is one. And then on the plan of care side, we already have all automated faxing. Now it'll be automated faxing and direct messaging. But again, being able to recognize that plan of care coming back and again, automatically associating it with the right file and the right record and doing all the follow-up if we don't get assigned one back. Those are the primary two.
And I don't know. We have some exciting relationships coming out to market that hope to actually even make that send and sign process for care plans even more affordable and more seamless on both the rendering and referring provider side that we'll love to share with you and talk about as we move forward too, to see if that is applicable to you guys as well. But wonderful. I can't think of a better conversation I've had around an EHR, no matter what the sector it's serving. And as a provider, I have to say I have probably been relatively biased in the past because I've always been one of those folks who felt like the EHRs weren't listening to me. They weren't building what I needed. They were building something that allowed billing and coding, which, yes, helped drive revenue for me, but not in the way that building a record that addresses the 4 domains you were talking about does for me. And it's so refreshing to hear that, to be honest with you. And I think you guys are unique in the market in what you're doing. So we're going to take a quick break, Adam, if you don't mind. But if you'll stick with us after the break, we'll conclude things. And I'd love to hear any final thoughts that you want to share with the group.
Awesome.
Discover the untold stories of the talented minds shaping Kno2. In this employee spotlight, delve into the journey and passion that fuels our team.
Can I have you introduce yourself, give your title, what you do for Kno2?
Sure. My name is Ryan Kelly. I have been here at Kno2 for quite a while. I'm currently serving as Senior Vice President of Technology. And what that really means is I get to work with the engineers. I get to help solve business problems and leverage our super bright engineering team to help solve those problems.
Nice. What is your why for working at Kno2 or in healthcare technology in general?
I would say really initially when I first came to Kno2, and it's been a long time, it was just some really cool technical challenges to solve, and that's evolved over the last 7 or 8 years. And a big reason that I'm here is to help facilitate the better exchange of records and to make healthcare easier and safer for patients. I've got 5 kids. I have a wife as well, and like we're constantly in and out of the healthcare system in different areas, and just to see what we're doing have an impact, even in my own family, is huge.
Absolutely. Out here trying to change the world. I love it. What's the best joke you've ever heard? If you can think of one. 9 times out of 10, I can't think of a joke.
Oh, I have no good jokes, and my dad jokes are all worn out. So
Got 5 kids and no dad jokes?
5
Dang.
kids and no dad jokes.
Okay. Are you someone who names your car? If so, what's the name of your car?
I am not someone who names my car, but I might have a son who names his car.
What does he
And
name his car?
oh, I can't even remember now. His first car was like a '96 Volkswagen Jetta, and it had a name.
Well, everybody I asked that question to has the same answer, which I think is weird. I've named every car I've ever had. What's the favorite room in your house and why?
Oh, I'm gonna give the cliche dad answer. I probably love the garage the most. Um, for me, definitely like between workshop stuff and that is like garage gym is there, ski storage, ski tuning, bike storage, bike maintenance. Um, like there's a lot there.
If you could go anywhere right now, everything, finances, all of that's out of the question. You could go anywhere right now. Where would you go and what's the first thing you would do when you get there?
I'm gonna go heli ski Alaska.
Okay.
Like
All
that's
right.
for me, that's an easy one. That's a bucket lister that's up there anyway. And like right now, given that it's the end of March, perfect time.
Absolutely. All right, last question. Let's see. If you could be, or if you could, would you be friends with yourself? Why or why not?
I think I would. Um, I think I love people, and I think that's another big reason why I'm here at Kno2 is I just genuinely love people. I love helping people succeed, watching them learn and grow. Um, and I think that is a real bonus.
Absolutely. All right, well, thank you so much for your time. It was great to talk to you.
Thank you, Jess.
Stay connected for more behind-the-scenes narratives as we continue to unveil the stories within our remarkable team. Connect, listen, transform. This is Kno2fy with your hosts, Dr. Peter Schuck and Teresa Bell.
Welcome back from break, everybody. I can't tell you, we've had a really far-ranging conversation. I've enjoyed the heck out of it, Adam, and really appreciate your expertise and insight and, quite frankly, the commitment to what you're doing in the 4 domains you're talking about, specifically for provider experience and patient experience, and then the other aspects around making it easier to run a physical therapy business through a single system of record that's integrated across practice management, patient access, and so forth. I would be remiss if I didn't give you an opportunity to emphasize anything we talked about or bring up anything new. I think we talked about the break. You wanted to bring up the importance of CMS in this space and some of the work they're doing. So I'd love to give you the floor and talk about that a little bit.
Yeah, I'm going to touch on Medicare, and one of the challenges that for some reason physical therapy is always receiving Medicare cut after Medicare cut after Medicare cut after Medicare cut, and while other healthcare verticals and sectors are not receiving those. And to me, the whole concept that physical therapy is this cost driver is a little bit crazy. As a personal anecdote, I have cubital tunnel syndrome in my elbow. 6 years ago, I went to an orthopedist. They said, you know what, you're going to have to get surgery to fix this. I looked it up. The surgery is about $30,000. And then I still need physical therapy after it. I guess unfortunately at the time, but actually fortunately, my insurance wouldn't pay for the physical therapy or for the surgery unless I went to PT first. I go to PT for 5 weeks, 10 visits. That's $1,000 cost, which I actually paid 50% of. So cost the insurer $500. I haven't had a problem with my elbow again. So and there's thousands, probably hundreds of thousands of those stories. So I think,
Oh yeah.
we just joined APTQI, and as we've scaled, it's like trying to do more of this advocacy. But I think it's one of the big headwinds, obviously, is that PT is this marginalized sector of healthcare. When really, if you look at any of the data, and the APTA has done such an awesome job putting together some of these studies and this data, like physical therapy is a massive cost saver and an outcome improver. And how can we get the CMS and Medicare and some of these other large insurers that make it hard to go to PT to view that? Surgery should be a last option. It should be after everything else is explored. So as much as, Prompt as a company and all of our client base in the industry as a whole, we have to keep finding creative ways to advocate and get data and figure out a way to shift that narrative, because PT is such a pivotal part of the healthcare journey. It can be a massive cost saver if it's used properly. And I think that's something that we're really, as a company, starting to put a lot of focus on now that we've reached a larger scale.
Adam, I love that, and it's a great reminder for advocacy in the space. And from somebody who has in population health his entire career as a provider and then as an administrator related to value-based arrangements, it is a cost avoidance service if done right, and actually improves outcomes. And take studies for low back pain that have been done for years and years and years that indicate that after a year, somebody who's gone to physical therapy and conservative management does as well as somebody who has spinal surgery or laminectomy for that slip disc. So there's just a lot to be said there, and I appreciate the reminder in terms of the advocacy. From my perspective, guys, things that stick with me in this conversation today, which I'll take away with a better understanding of not only the PT EHR space, but the PT space and how to look at it. Adam, the four domains you talked about, and if I have them right, it's really around the patient, the provider, the practice, and driving efficiency in the practice. And I probably forgot the fourth one. I didn't say that well, but that deserves re-emphasis, and I would love it if you correct me and re-emphasize those domains, because that really stood out to me as a novel approach, a needed approach, and something that I think sets Prompt apart in what they're doing.
Yeah, absolutely. I'd revisit that. It's kind of the core of our entire company, so happy to revisit it. But there's 5 users of our software, right? The patient, the provider, the administrator, the biller, and then an owner or a management role. And what we look at is always these 4 things. We need to make every user in that group more efficient, to make their job easier, automate things, decrease the amount of labor they need. Wow your patients, that's pivotal, because like we said, every practice pretty much in the country has enough patients that they could be fully booked and super profitable if they scheduled them properly, if those patients came back to care. And not only do you make more money, your patients get better outcomes.
Yep.
The third, obviously, and these first 2 tie into this, everything we're doing is built to impact your P&L, either decrease costs, grow revenue, do both. And all of that leads to happier staff, to kind of solve this massive burnout problem, the staffing problems that PT practices are having, both on the administrative and the clinical side. So it's a flywheel effect of, by focusing on those 5 user groups and these 4 things, we can create this product that has a massive impact to PT businesses, grows their margins oftentimes by double-digit percentages, keep their staff longer, and provide better care and have happier patients.
Man, Adam, I can't follow that. All that's left for me to do is thank you for being with us today. Thanks for being a partner of Kno2, and we look forward to working with you and serving you guys in the work that you're doing. And thank you today for being with us today and sharing your company, your thoughts, and your visions with the audience. Really appreciate it, Adam.
Yeah, no worries. And just wrapping up, I know in physical therapy, with the reimbursement declining and costs going up, it's really critical that PT clinics around the country are taking a step back to evaluate their business and their process and make sure they're operating as efficiently as possible. I know you don't wake up every day wanting to switch your EMR, but obviously don't hesitate to reach out to us at Prompts. We're happy to give you a demo. And even if you're not looking to switch your EMR, just maybe give you a helpful tip or 2 on how to help you step back and try and run your business more efficiently. So we'd love to meet more PT clinics and get more demos and try and help you, operate more efficiently in this, with all these headwinds going on.
Sounds wonderful. Adam, have a great rest of your day, and thank you so much.
Awesome. Thanks, Peter.
Thanks for joining us today. That's a wrap for this episode. Please subscribe or follow on your favorite podcast platform to make sure you don't miss an episode. Get Kno2 connected today and set yourself and your organization free to unlock your potential. For more information on the value of being Kno2 connected, visit us at www.kno2.com. Follow us on LinkedIn or Twitter. Connect, listen, transform.